Hi, how are you?
Good and yourself?
How's it going? My name is Carlos Calderon. I'm a student physical therapist with the University of St. Augustine, Miami campus. Today, I'm going to be doing a little examination on you. I understand you've been experiencing some symptoms, so I just want to look around and see if I see anything that's a little abnormal or anything that I can do to help you. If at any point you feel any discomfort or you want to stop, please let me know and we can take a break. Today I am going to be putting my hands on you, so I just wanted to go ahead and get your consent for everything that I just said prior to us beginning.
Yes.
Does that sound okay?
Yeah.
Okay, so are you comfortable removing your t-shirt?
Yes.
Okay, so if you can go ahead and do that for me. Alright, Mr. Ortiz, what I want you to do now is the first view I'm going to do is I'm going to be looking you from an anterior view. So what I want you to do is relax, and then I just want you to look at that wall. Find a point at the wall, and then I just want you to relax. And then for the sake of today, if you would be comfortable removing your mask?
Yeah.
Okay, so just relax. Okay, so what I'm looking for is I'm looking for the head posture. I'm looking at his shoulders. And then I'm moving towards the pelvis area, so I'm looking at the ASIS. Okay, from this view, everything seems to look okay. My patient displays slight forward head posture, which is indicative of subcranial extension and cervical flexion. So now we'll move to a posterior view. So if you could just stand a little forward, I'm going to change the camera angle. So with the posterior view, I'm going to remind my patient to breathe and relax and just look at the wall. So with the posterior view, what I'm looking for are looking at the cervical spine. I'm looking to see if any discrepancies between the shoulders. And I do see that my patient's left shoulder is a little more higher than his right. All of the back. Look at the PSIS. Medial malleolus. Okay. And then I'm gonna move to a lateral view. So you're fine there. Just over here. So same sequence. Just gonna scan my patient down. See the forward head posture. See the slight humerus. The humerus is slight anteriorly. Okay, and then the feet look to be okay. So now, Mr. Ortiz, I want you to relax. Okay, so now I'm going to move into, I want you to do the same thing. Just pick a point at the wall. And now what I'm going to do is I'm just going to palpate a couple structures. So I'm going to be putting my hands. My hands are going to be a little cold, so I don't want you to go crazy. Okay?
Good.
So, palpate for those iliac crests. ASIS. Move. Bring up all four. PSIS. Seems to be alright. And I'm going to move down. I'm going to look for that fibular head. Looks to be in line as well. So, and then come in medially for the medial malleolus, and they look to be in line as well. Okay, Mr. Ortiz. Now I'm just gonna ask you to take a seat here.
Would you be
or on the table is fine, actually. And then what I'm gonna do is, so I'm gonna verbalize, but for the sake of the camera, I would be in front of my patient. I never want to be behind them, but for the sake of this video, and for the sake of showing the fact that I'm going to be palpating for the iliac crest in a sitting position, I'm going to be doing it posterior. So I'm checking to see if the iliac crests are in line, and they do seem to be in line. So my patient does not have any abnormalities. So Mr. Ortiz, you can relax. Okay, Mr. Ortiz, so we just completed the structural inspection portion, so everything looks to be okay with some minor things that we need to work on, but that's okay. Nothing completely abnormal. So now what we're going to be doing is we're going to be moving to the active range of motion portion of the examination. So with this portion, what I want you to do is I just want to assess how you're moving, and I want to see if there's any limitations or any excessive movements. Okay, so I am going to tell you the movements that I want you to do. So the first movement I want you to do is going to be flexion, so just look at me, and then extension. Okay? So as you do these movements, I just want you to imagine if you had a pole running through the your oral mouth, and then I don't want you to break that pole. Okay? So I'm sorry, not between your mouth, but between your ears. Okay? Does that sound okay?
Yep.
All right. So I am going to stand. And I am going to cup your chin and your occiput. And then I want you to go ahead and do that. Okay, relax. Do it one more time. Put some more pressure. Relax. And then I am going to take a goniometric measurement for cervical flexion. So I want to say that you looked right about normal. So I want to say it's approximately 40 degrees. So, Mr. Ortiz, I want you to go ahead and do that for me. My patient is able to get to 40 degrees, so he is normal for cervical flexion, subcranial forward bend. So now, Mr. Ortiz, same thing. I want you to imagine like you have that pole running through your ears, and then now I want you to go in the opposite direction. No. There we go. Relax. One more time. Okay. And reset my goni. Now landmarks are external auditory meatus for the joint axis. Moving arm is in line with the nose, and then the stationary arm is in line with the midline of the body. So I want to say that you got to approximately 20 degrees. So, and that for me. Relax. And it seems like you have normal subcranial backward bend. So now, Mr. Ortiz, what I want you to do is I want you to go ahead and as I mentioned before, what I want you to do is I want you to imagine like you have a pole running through your mouth and going through the back of your skull. And then what I want you to do is look at me. I want you to bend your, bring your ear to your right. Okay, go ahead and do that for me. And then now I want you to go ahead and do this for me. Okay, relax. Alright, so now I am going to go ahead and do that process again. Okay, so going back to the cervical side bend and cervical rotation portion of the active range of motion. So I am going to ask my patient to breathe and relax. And then, Mr. Ortiz, I want you to go ahead and bring your left ear to your left shoulder. Remember, you have that pull. Okay, relax. Okay. Now, what I want you to do is, I want you to go ahead and do it on the rotate. So I want you to remember, like, you have that pull, and I want you to turn your head essentially to the left side. Okay, relax. Alright, I'm going to go ahead and do that again. So what I'm going to palpate for is C7, T1. And then I'm going to have my patient go ahead and do that. Okay, relax. And then for the sake of rotation, I am going to measure it. So I'm going to have my joint axis at the top of the head, stationary arm in line with the bisecting acromions, and then moving arm is going to be in line with the nose. So go ahead and do that, Mr. Ortiz. Alright, looks like you're able to get to 45 degrees. Okay, so I was able to take my goniometric measurement for cervical rotation. So now I am going to go ahead and do cervical side bending to the right and to the left side. But this time I am going to elevate my patient's scapulas. So Mr. Ortiz, I want you to go ahead and side bend to the left and to the right. Relax. Okay. Relax. Alrighty. So for the interpretation of my active range of motion, I would like to state that my patient seems to have, this is a hypothesis, so further testing is still needed, but it seems like my patient has a scapular issue, so I would want to further assess the scapula, as it was indicative of my patient having more range of motion, as I eliminated the scapula when assessing cervical side bending. Another note that I noticed was that my patient had limited cervical rotation, so I want to keep that in mind. And the final component that I want to keep in mind is my patient did have normal movement as I was palpating while he was doing cervical rotation, as when he was rotating to the left facet moved in a up and forward position. Okay, and that was the active range of motion for the left side. Now I will be doing the right side. So Mr. Ortiz, it's going to be the same concepts that we just went over. We're just going to be assessing your right side. So the first motion I want you to do is, remember, picture like if you had a big tube running through your ears and you don't want to touch it. So I just want you to go ahead and try to bring your chin to your chest. Okay. Relax. and then go ahead and do the other way. So I want you to look up. Okay. And so now, Mr. Ortiz, what I want you to do is we're going to do right side bending and right rotation. So what I want you to do is I want you to imagine like if you had a pole running through your mouth, through the back of your neck, and you don't want to interfere with that. Does that sound good?
Mm-hmm.
Okay, so I want you to go ahead and do that. So I want you to go ahead and rotate, and then relax. I'm going to go ahead and take a goniometric measurement. I'm going to estimate that my patient has a little more rotation here. Looks like about 50 degrees, so go ahead and do that. Okay, so yes, my patient has 50 degrees of active range of motion to right cervical rotation. So Mr. Ortiz, for the sake of the video, we're just going to go ahead and repeat the side bending portion. So this time I just want you to side bend to the right. Okay, relax. And interpretation for the right side is my patient has seems to have a scapular issue on the right side as well, as he had more cervical side bending to the right when the scapula was eliminated. To complete my active range of motion, I will be doing cervical backward bend and forward bend. So now, Mr. Ortiz, we're going to be assessing a different portion of your body. So it's going to be the same movement, but I don't want you to imagine like you had any type of pull or any type of restriction, okay? I just want you to relax, and then I want you to maintain an upright position, and then I just want you to bring your chin to your chest. Okay, relax. Alright, and now what I want you to do is do that again. Okay, relax. Now what I want you to do is I want you to extend. So look at me. I want you to do this. Go ahead and do that for me. Alright, relax. I'm gonna go ahead and do that one more time. Go ahead. Alrighty. And then now what I want you to do is I want you to rotate to my left side, and then we're going to assess your right side. But again, I don't want you to think like there's no pull, so I just want you to rotate. Go ahead and do that for me. Alright. Now go ahead and do it to the right side. Alright, relax. So now I am going to go ahead and take a goniometric measurement to see if everything is okay. So Mr. Ortiz, I want you to relax. Go ahead. Alright, relax. So it looks like my patient got two. I'm sorry. I want you to do it on the right side. Okay? So we assess the left side. I want you to do it on the right side as well. Ready? Okay. Relax. Alright, Mr. Ortiz, so now we're going to be moving into the neurovascular portion of the examination. So what I'm going to be doing is I'm just going to be assessing some sensation, some strength, some reflexes, and I'm just going to be checking to see if all your spinal nerves are doing okay. You might feel a little bit discomfort. If you do, just let me know. We can stop. Do you have any questions for me? Do I have your consent to begin?
Yeah.
Alrighty. So, first thing I want you to do is I want you to look at that box of chocolates, and then what I want you to do is breathe and relax. And so I'm gonna try to push you back. Don't let me push you back. And then I am gonna hold this for 10 seconds. Relax. Alright, so I just assessed your C1, C2 myotone. Next one I'm going to be doing is side bending. So I'm going to relax. I want you to be in this position, and I'm going to try to push you in the other direction. Don't let me do that. Alright, so you did that for 10 seconds. Now the next one I'm going to be doing is C4. So for C4, I want you to go ahead and come here, and then I'm going to push you in. Don't let me break you. 10 seconds. Relax. Okay. Now what we're going to be doing is we're going to be doing C6. So for C6 for today, I'm going to be assessing it like this. It can also be assessed down here, but I just want to do it like this. Okay, Mr. Ortiz, I am going to try to bring you down into extension. Don't let me do that. Alright, relax. Alright, so now we're going to be assessing the triceps. So now I'm going to be trying to push you into flexion. Now don't let me do that. Alright, 10 seconds. Alright, Mr. Ortiz, so I want you to go ahead and bring your thumbs up like this. Alright, so now I am going to try to bring your thumbs down. Let me do that. Alright, 10 seconds. So now we are going to be doing T1. So I want you to go ahead and spread out your fingers like this. And so squeeze into me. Okay, relax. Now, that is it. So that was the myotomes portion. Right, so the next portion of the neurovascular examination will be the dermatome portion, but I just want to state that for the myotomes portion, I would have tested the other side as well. Okay, so now I'm going to go ahead and do the dermatomes. So let me just explain to you. So now I'm just going to be testing and moving, touching around different parts of your body. I'm just going to be looking for sensation. So I'm going to touch one part of your body, and then I'm going to touch the other side. And then I'm going to ask you, does it feel the same as the other side? And then I want you to tell me yes or no.
Okay.
Okay? Do you have any questions, Concerns?
Yep.
Do I have your consent to begin?
Yep.
Alright, Mr. Ortiz, so I just want you to breathe and relax throughout this. I'm going to start with C1, sorry. So, feel that?
Yep.
Okay. The next one I am going to do is going to be, well, alright, so the next portion of the neurovascular examination will be the dermatome portion, but I just want to state that for the myotomes portion, I would have tested the other side as well. Okay, so now I'm going to go ahead and do the dermatomes. So let me just explain to you. So now I'm just going to be testing and moving, touching around different parts of your body. I'm just going to be looking for sensation. So I'm going to touch one part of your body, and then I'm going to touch the other side. And then I'm going to ask you, does it feel the same as the other side? And then I want you to tell me yes or no.
Okay.
Okay? Do you have any questions, concerns?
Yep.
Do I have your consent to begin?
Yep.
Alright, Mr. Ortiz, so I just want you to breathe and relax throughout this. I'm going to start with C1, sorry. So, feel that?
Yep.
Okay. The next one I am going to do is going to be, well, so C2 is going to be back here. You're not able to see, but what I'm assessing is the crown of his head. Do you feel that?
Yep.
Okay. So now, does that feel the same as this?
Yep.
Okay. Now gonna be feeling this. This feel the same as this.
Yep.
Okay. So that was C4. So now I move into C5. Does this feel the same as this?
Yep.
Okay. So now C6. Let me go ahead and do that again. So for C5, I just want to make sure it's the lateral shoulder. So I'm coming down all the way to the arm. Does this feel the same as this?
Yep.
Okay. So C6 is going to be the first digit. Does it feel the same as this? Okay. So C7 is going to be the dorsum of the hand, and it's going to be the middle fingers. So do the same as this.
Yep.
Okay. Now I want you to have your palms up, and then does this feel the same as this?
Yep.
Okay. And then the last one is going to be the medial portion. So, does this feel the same as this?
Yes.
Okay. So, that is the dermatomes portion. So, ideally, I would have some type of sharp tool, but I don't. So, I'm going to go ahead and verbalize that I would have done sharp sensation testing on my patient, and I would have followed the same dermatomal sequence. Alright, Mr. Ortiz, so we just finished the dermatomes portion. So now what I'm going to do is I'm going to be checking your reflexes. So essentially what this is, it's I just want to make sure that your nervous system in your brain is functioning properly. So I just want to make sure that you have the correct reflexes, okay?
Okay.
So I am going to be using a special tool today. So this is called a reflex hammer. So I am going to be applying some pressure mostly to my my body.
Mm-hmm.
and I am going to be palpating for certain structures. Is that okay with you?
Yes.
Alright, so the first one we're going to be doing is going to be the C5, C6 reflex, which is the biceps reflex. So I just want you to breathe and relax. And what I'm going to be doing is I'm going to ask my patient to, I want you to flex. Alright, so relax. So I palpated for that biceps tendon, and I'm going to squeeze on the biceps tendon, and then I'm going to go ahead and bring my thumb into slight flexion. Okay, I'm going to go ahead and do this 3 times. And I saw my patient has a normal reflex, which is a 2+. So the next reflex I'm going to do is the brachioradialis. For the brachioradialis, I'm going to have my patient forearm pronated. I'm going to bring him into neutral, and then I am just going to apply pressure. Okay, so I went ahead and did that 3 times, and my patient showcased normal reflexes for the brachioradialis. So now I'm going to go ahead and do the C7, C8, which is the triceps. So I want the elbow in extension. I'm going to go ahead and palpate for that triceps tendon. And then what I want you to do is breathe and relax. And I go ahead and okay. And my patient has normal reflexes on all of his cervical reflexes. I apologize, so I still have 3 more reflexes I have to go through. So the first one I'm going to be doing is the Shimazu. So the Shimazu, I'm going to have my patient, I'm sorry, mispronouncing that. Patient is seated, and what I'm going to be looking at is I'm going to be palpating for the acromion, come on the posterior side, and then I'm going to look for the spine of the scap. I'm going to come in between both of these structures, and then what I'm going to do is I'm going to apply okay, and this was negative as I did not see shoulder elevation, so my patient has normal reflexes. So now I'm going to go ahead and move into the inverted supinator sign. So it's going to be the same test as the brachioradialis, except that for this test, I'm going to be looking for my patient's thumb and index finger to come together. Okay, so I want you to breathe and relax. Alright, so my patient's fingers did not come together, so this is a negative test. Alright, and then Hoffman's sign, or Hoffman's test. So I'm just going to go ahead and grab, oh, that's a bad finger. Alright, so I'm going to grab his third metacarpal. I'm going to stabilize there, and then I'm going to go ahead and flick the fingernail. And a positive finding is if the thumb and the index finger come together, but that did not happen, so my patient has a negative reflex for heart. Alright, so now I will be doing the neurodynamic testing for the radial nerve. I have my patient supine, so I'm just going to go through a brief informed consent. So Ms. O'Brien, I'm just going to assess your nerve distribution to see if there's anything going on with any of your nerves. If you feel any numbness, tingliness, or pain, please let me know. And if you feel like we need to take a break, please let me know. Do I have your consent to proceed?
Yes.
Alright, so for the sake of this video, I am going to state that I would have done the unaffected side first. But the first thing I'm going to do is I'm going to check to see if my patient is able to get to the movement. So Miss O'Brien, what I want you to do is I want you to go look at me and I want you to replicate this movement. Are you able to do that?
Mm-hmm.
Right? Does that replicate any of your symptoms?
Mm-hmm.
All right. So now what I'm going to do is I am going to depress my patient's shoulder. I'm going to bring my patient into some abduction, and I am going to bring my patient into slight elbow extension. Then I am going to make a fist for fingers, and then I'm going to pronate and internally rotate, ulnarly deviate, and then I'm going to abduct a little more. So as I'm going through all of this, I would have asked my patient, does this replicate any of your symptoms?
Mm-mm.
Throughout each sequence. So to finish off the radial nerve neurodynamic testing, I'm going to ask my patient to bring her right ear to her right shoulder. Does that replicate any of your symptoms?
Mm-mm.
Okay, Miss O'Brien, I want you to bring your head back to neutral. I'm going to slowly bring her back into that resting position. Alright, so now I am going to be doing the ulnar nerve. So for the ulnar nerve, Miss O'Brien, if you could just look at me. So the movement I want you to do is actually, hold on, my computer froze for a second. Alright, so what I want you to do is I want to know if you could do this movement, so just look at me. Are you able to do this movement?
Mm-hmm.
Does that replicate any of your symptoms?
Mm-hmm.
Alright, now I want you to do that same movement and bring your right ear to your right shoulder. Any symptoms there? Alright, Mr. O'Brien. So what I'm going to do first is I am going to bring your wrist into extension. I am going to pronate your forearm. Going to externally rotate. Going to depress your shoulder. And then Alright, Mr. O'Brien, so now we're going to do the neurodynamic testing for the ulnar nerve. So what I want you to do is I want you to do this position. You can see what I'm doing. And I want you to bring your right ear to your right shoulder. Does that replicate any of your symptoms?
Mm-hmm.
Okay, come back to normal. Alright, so for the sake of this video, I would have stated that I would have done the unaffected side first and followed by the affected side. So I'm just going to go ahead and do the right side. So first thing I'm going to do is I'm going to bring my patient's wrist and fingers into extension. Then I am going to pronate the forearm, flex the elbow, bring the shoulder into abduction, and then I'm going to depress the shoulder and then slowly bring the shoulder into more abduction. I'm going to ask Miss O'Brien to bring her right ear to her right shoulder. Does this replicate any of your symptoms?
Mm-mm.
Alright, you can go back to normal. And I'm slowly going to come back. Okay, and for the sake of neurodynamic testing, I just want to state that as I went through each segment of the test, I would have stopped and asked my patient if any symptoms were replicated throughout each step of the testing.